Obsessive-compulsive disorder, otherwise known as OCD, is more than just wanting things tidy, neat, or organized. It's a mental health condition that affects the way someone thinks and behaves, and it affects 1 to 2% of the general population. The symptoms of OCD first include the presence of intrusive thoughts. These can be unwanted images or urges that somebody experiences that often cause a lot of distress, fear, and sometimes disgust. Since someone with OCD experiences unwanted intrusive thoughts, they also experience really uncomfortable emotions, and they use compulsions at attempts to deal with these emotions. However, every time that the person feels anxiety, fear, distress associated with these thoughts, they then get into a loop where they feel like they must engage in the compulsive behavior. By doing this, they never learn to tolerate the distress associated with unwanted intrusive thoughts, and thus that's how the cycle of using compulsions gets started for someone with OCD. To get a formal diagnosis of OCD, you'll first meet with a mental health professional for a clinical interview. In this clinical interview, the professional will gather information about the intensity and frequency of your symptoms, as well as how long you've experienced them. They'll also gather information about your medical history, as well as your family mental health and medical history. They'll use this information to determine an accurate diagnosis. A lot of times when diagnosing OCD, a professional might use a Y-BOCS, which is known as the Yale-Brown Obsessive-Compulsive Screener, which is specifically made to address determining if someone has OCD. The good news is OCD is highly treatable. Research has shown that exposure and response prevention, otherwise known as ERP, is the gold standard for treating OCD. In this therapy, you'll work with a professional to help identify your fears, and in a gradual and systemized way, that professional will help expose you to those fears without the use of compulsions. By doing this, you'll learn distress tolerance and learn that you no longer need to use compulsions. Another helpful therapy for OCD is acceptance and commitment therapy, otherwise known as ACT. This is a therapy that helps people to manage their unwanted intrusive thoughts and compulsions by changing their relationship with them. People learn to make different meaning of the presence of these thoughts and to be able to continue to live their lives in values-driven ways. Remember that OCD is not a one-size-fits-all in terms of treating it. It does require some trial and error, but with support, patience, and the right tools, it is totally possible to overcome. I'm Dr. Katie Burns, a licensed clinical psychologist here at Northside Behavioral Health Services. If you have any questions or concerns, please leave us a comment below. For more information, visit northside.com and search Behavioral Health Services.